Good evening. Thank you so much for tuning in. I'm Amitha Balachandra. While the focus has been on big cities and how COVID has impacted big cities till now, we've been talking about hospitals running out of beds, we've been talking about lack of oxygen supply. We must talk about what's going on in rural parts of the country because we see a shifting trend from big cities to smaller cities. An SPI research report, which was released on the first week of May, has said exactly that it is a worrying trend that we're seeing right now because the share of rural districts in new cases it has increased to 45.5% in April and 48.5% in May compared to 36.8% in March. That's nearly half the new cases that's been reported across the country that's coming in from rural areas. So this is what we've decided to do. Starting today, we are dedicating some time every single day to talk about what's going on in rural parts of the country, basically taking the focus away from big metros because we must talk about how rural areas are grappling with COVID. We're going to call it the Rural Report. So, on the Rural Report today, we focus on rural Maharashtra because while we're talking about a declining trend in cases in big cities like Mumbai and Pune, rural Maharashtra is not looking very good. Reports say that rural districts of Buldana, Ahmednagar, and Parbhani, for instance, have been witnessing the highest positivity rate for the last 3 weeks. Marathwada, for instance, is also a cause of concern. To talk about what's really going on and to give us an idea of how worried we should be, I have with me senior journalist Sudhir Suryavanshi, who is joining us right now. Mr. Suryavanshi, thank you so much for joining us and giving us your time. My first question to you is: you've written an article in the New Indian Express which talks about areas in Marathwada and high positivity rate and mortality rate as well. But why, according to you, Marathwada, for instance, is a cause of concern?
In Maharashtra, Mumbai, Pune, Nagpur, those are the metro cities which were, high number of positive cases and mortality were reported earlier. But now the Mumbai and other metro cities are on the path of the recovery. There is a major drop in the positivity and the mortality also. Only the major concern is the Marathwada region, that is the central part of the Maharashtra, where also the Parbhani, Usmanabad, Beed, Latur, Nanded, these are the chronic districts where the high number of cases has been reported, and there is no yet sign of the drop in the positive cases and the mortality so far. The major reason behind this, what I found that discipline, the self discipline is also equally important along with the corrective measures taken by the administration. In rural India, this summer season is particularly for the wedding seasons. After finishing the agriculture work, the people generally engage in weddings, in all sort of the social gatherings. Government has restricted, the numbers of the people, how many people should attend the wedding, weddings and all social functions. But still, the police and the administration cannot reach each and every nook and corner of the state. They cannot monitor every wedding. So, but I got information that the people are still, having these marriages and social function with a large number. The number has cut down, but still there is a large number. They are plotting the guideline prescribed by the state government. Another major factor, what I found that in the people are not directly coming to the major hospitals once they observe the symptoms of COVID-19 and other things. First of all, they consume the medicine at a home only, like a paracetamol or something like that medicines, and they delay to reporting their own health, and that causes more damage than the curing these people. Therefore, in Mumbai and other cities, people generally, if they get symptoms, they immediately test themselves and get admitted out, start taking medicine once they are home quarantine. So these things are rarely happening in rural areas. Home quarantine is sometimes it's a distant dream because of the short space and many people are at the home and there are no separate toilets and bathroom. They have used the common toilets and bathroom. So these are the major, I think, reasons behind spike in the rural area, particularly in Marathwada, and this will continue for a few more days.
I also want to understand from you, do you believe that from municipal corporations itself, and I'm not talking about big cities, but smaller cities, for instance, where you have municipal corporations, and do you believe that the number of cases are moving away from these municipal corporations to districts, for instance, because that's the trend that Osmanabad and even Ahmednagar, for instance, has witnessed, because there are reports talking about how cases are moving towards districts away from municipal corporations.
Yes, true. This is true because districts and the rural area is completely two different things. In districts, there are the government, civil hospitals. There are some major hospitals are there, but in the rural areas, the health facility is not that much adequate to address all these issues. And in rural areas, people generally rely on the local doctor who come to their places once in a while or something like that. So that has delayed the treatment, and that has been resulted into the high mortality, and the person who is staying at home but not taking proper medicine is also at the same time infecting as many as people. So the virus has been not chased, not even properly traced, and the breaking the virus chain is also sort of the long way to go here.
And in that chart, if you could see Ahmednagar, Solapur, Kolhapur, all of these places, you see that the number of cases are more in districts, like you were pointing out, than municipal corporations. I also want to ask you this then: what happens to ICU and oxygen supported beds? Is there a shortage at all? What happens if we see a continuing rise in cases? Because a couple of days ago, we know that the Maharashtra Chief Secretary had written a letter saying that the state needs an additional 200 MT of oxygen supply every day, and had pointed out that 16 districts, including Palghar, Kolhapur, Solapur, all of the areas where we're seeing a surge in cases, which have run out or will run out of oxygen supply. So, what's the situation right now?
One thing we have to understand, the patient will go to the hospital, and where if there is no oxygen, then he will suffer. But here we can see the patients are not going to the hospital. He is taking treatment at a home only. So that is the difference. So the shortage will be reported when there are large number of people are flocking to the hospitals and demanding for the oxygens. Many people who have got their own self immunity are taking the treatment at a home only, delaying their treatment. So therefore, the issue is there. Shortage of oxygen is there, but it is not that much severe because of the low reporting patient to the major hospitals.
I also want to understand from you, a report about 2 weeks ago had said that if cases continue to rise, and we'll put up this report in a while, that only 7 districts out of 36 will have isolation beds. The government had also said that they would be linking patients in rural areas to doctors from urban areas. Is that happening at all?
That is happening, but the scale of that exercise is not that much, so it can address this entire issue which the rural Maharashtra or the rural India is facing. Because you need a large number of health worker, doctor. In the cities also, doctors are short staffed, so they have also tackle all these issues in their respective hospitals. So therefore, they have very less time to go out and treat the patients in other location, particularly in rural areas. So therefore, the shortage of doctor and is a major issue. If you remember, the few days back, Maharashtra cabinet has a meeting where they have taken the decision of recruiting the 13,000 employees in the health department. So 13 at present there is a vacancy of 13,000 people, and the pandemic is there, so we need major many people to handle this entire crisis. So short stop is a major issue. Government should work on this thing on the war footing. Wherever the plugs are there, they should address this issue, recruit more doctor, more health worker, then save more lives.
Two things that I want to talk about, apart from oxygen beds and ICU beds as well. If you can tell us what the situation is as far as vaccination drive is concerned, because over the last couple of days we've seen that across the country it's a big problem in rural India. What about rural Maharashtra? Because we know that the big cities have run out of vaccines and there's a massive shortage across the country, in fact.
See, if you see the picture of the, you were talking about the Maharashtra. In Maharashtra, I think Kolhapur is the only district which has done the highest, large number of vaccination for the eligible population above 45-year old. Then there are some major cities. I think Western Maharashtra has done, remarkable job in the vaccination, particularly Kolhapur, Sangli, Satara. And then after that, these are the semi-urban areas. If you see the urban areas, like Mumbai, Pune has done the quite good vaccination. But if you see the, Nandurbar, then Gadchiroli, Gondia, Palghar, these districts, the percentage of vaccination is barely 17%, 17%, while Kolhapur percentage is almost 60% in the eligible population, while Mumbai percentage is almost 40%. And one side urban is 40%, the rural is only 17%. So there is a wide, gap between the urban and rural in terms of vaccination also. Initially, there was a hesitancy for the vaccination. People were hesitant to, get themselves administered the vaccine. Now they want vaccine, but there is no enough vaccine available at the center.
And what about testing? Do you believe that we're testing enough in rural areas?
Testings are not that much enough in the rural areas. As people were hesitant to, vaccine, they are also hesitant to test themselves. They feel there's something, weird kind of virus or weird kind of disease is there. So they are reluctant to test themselves.
Also, tell us then what is the major cause of concern right now, as far as rural Maharashtra is concerned, with the kind of cases that are growing, and what should we be doing at this point?
See, cases are rising. At the same time, there is no adequate number of vaccination. So these things are cause of concern. If you remember, the second wave, which particularly is started in the Amravati and some part of Vidarbha. That time, rest of the Maharashtra was killing out, and everybody was in the mood that the corona has gone, and everybody was started celebrating and attending parties, and all things were happening. But suddenly, the virus got this, condensive atmosphere in some part of Vidarbha. Then it started immediately spreading to other part of the Maharashtra, and then we reached the peak to almost in a day. Once we reported 69,000 cases, positive cases in Maharashtra. So that added a big, huge number in the positive cases. So therefore, we have to have equal number of resources focused to rural Maharashtra only. By addressing one city or one particular area will not resolve the problem here. The virus is a global problem. So every nook and corner, every area of the world or every area of the rural has to be, addressed. Everybody has to be vaccinated. Everybody has to be tested. Everybody has to be given the proper treatment. Then only we will come out from this entire pandemic situation or entire devastation.
A quick recap of what you've basically said is that there's shortage of healthcare staff and lack of healthcare facilities, and that's a huge problem. Lack of awareness because a lot of people don't report what's wrong, and that there is a wide gap in the vaccination process itself when it comes to rural and urban areas. But you've also said that door-to-door health checkup is what is of utmost importance right now, and the vaccination process itself, and the only way to do this is to vaccinate everyone as soon as possible, and that's going to be a bit of a challenge right now with the shortage, but that is what is required. Mr. Suryavanshi, thank you so much for joining us. Here's what we're going to do. We're going to keep a close watch on what's going to happen, not just in rural Maharashtra over the next couple of days and a couple of weeks, but also across the country, because the focus has to shift from big cities, and that's exactly what we're doing here on the Rural Report. Thank you so much for tuning in.